Okay, resuming now with Lecture 1. This is Part 2. Ignore the fact that it says Slide 10 here at the bottom, because when we go now to the next slide, Slide 11 now aligns with the slide set that you have. So the slide set 11 in your slide set is this slide set 11. So that's a little trick I had to do to get everything to align in these truncated slide sets. Okay, so continuing on. In our overview of principles of oral rehabilitation. Let's deal with some of the W's, the who, what, why, when, where, how, that kind of stuff. Why is it necessary? Who benefits? Sort of in a sense, who does it too? When is it implemented? What is it? How is it done? All those sorts of things. Okay, so first up, why is it necessary? Why is oral rehab necessary? The fundamental concept, I suppose, is that oral rehab is necessary to reduce disabilities. Earlier slide 9, we said that one of the outcomes of successful oral rehabilitation was to reduce hearing-related disability. We're going to have a whole lecture unit on the notion of disability and some of the contemporary language that will follow here in a short version over the next 3-4 slides. But the basic idea is that this notion of disability is this interaction between the person's body and their characteristics of health or lack of health, and the environmental features and the features of society in which you interact. So disability is generally said a complex term. We'll talk about it more as we go through. The key factor, one of the key factors really in determining disability is when a person incurs a change, loss, or reduction in body function or structure. That right there is the definition of impairment. So impairment is a determining factor in disability. And again, impairment then is some kind of change or typical reduction in body structure and function. This language, which is contemporary language of disabilities, comes from the WHO, the World Health Organization, which is the language that tends to be used now for talk of in disability. In World Health Organization, one of their products, one of their models, I suppose, is the ICF. The ICF stands for International Classification of Functioning, and the ICF is a sort of a system of categorizing health conditions. They have other classification systems too. They have ICD, an International Classification of Disease, but that's not one we're interested in here. And on this particular slide, you can see the more or less the relationships between some of these things. So here we have body structure and function. Where's my pen? There it is. And so the inability to have complete body structure and function then turns out to be impairment. Now, other related aspects of the ICF model incorporate activity and participation. So someone who has completely healthy body structures and function would then have the capacity to complete all activities that are relevant, and then would be able to fully participate in society. And so what we'll see then is, as a negative aspect, would be that when someone has impairment, that means they're going to have some limitation in activities, and they're going to have some limitations and restrictions in the kinds of participation in life things that they can do. Underlying all of this are things that are environmental factors as well as personal factors in the individual. So if nothing else, even in this very simplistic model, you can see that there are many factors that are going to determine whether or not a person is going to have sort of negative outcomes. And again, the basic negative outcomes that we would consider would be when impairment imposes limitations on the activities an individual can do and restricts the sorts of life participation things that they can do. So continuing on with this, we said that disability is this umbrella term that in contemporary terms includes both impairments, activity limitations, and participation restrictions. Again, these latter terms are WHO, ICF kinds of terms that are you should be seeing in the literature. Activity limitation is a difficulty that an individual has in executing tasks or actions. And again, we'll talk more about this as we go through, but the kind of tasks that we're thinking about here is the inability to comprehend speech. Sorry if that's illegible. And a participation restriction is a problem experienced by a person in life situations, sort of in social circumstances. I'll have to get better at that as I go through this. Taken out of the ICF, and we're going to do an activity a little bit later in the course on this. We'll do an activity on this, is a way to kind of align these things. So you might have an underlying health condition, and so they don't have hearing impairment as one of these, but we could think of, let's look at spinal injury as an exemplar. So the health condition is a spinal injury. Now that leads to a particular impairment, the impairment of loss of function. So the spinal injury is the cause, but this is what the outcome of that is, which is paralysis. The activity that this person would be unable to do, incapable of doing, would be using public transportation. So that's activity. And that then restricts their participation, so they're not able to do certain things. So here they give an example that they're not able to, in this case, participate in religious activities because they couldn't get public transportation. So that's the sort of logic. Now, what we're going to want to do eventually is going to think about making this being the hearing loss being the impairment, being the health condition, and then we'll talk about the specific impairments and limitations, and we'll work it that way eventually. All right. So in more slides than necessary, maybe that was why oral rehab is necessary. Oral rehab is necessary to reduce the disabilities that are imposed by hearing impairment. Okay, who's affected by hearing impairment? And again, as I mentioned to you already, that the who is going to be us someday. So at least in the short term then, who do we call the recipients of our interest in oral rehabilitation? There's a variety of different ways that we could classify the populations. Now, certainly one of the major challenges in a course like this is the fact that we've got a fairly large population of people with hearing impairment that have a variety of different manifestations and presentations and problems and needs. And additionally, that the variety across that population is also embodied in the classifications that are used. So there's many ways that we could describe the individuals that we have an interest in. None of these that you see here is going to be exactly perfect, so it's going to just depend. So one of the more classic ways is to describe people based on their audiometric data, so based on their audiologic test findings. So that might be then based on what you learned in COMD 445, which is you're talking about severity or severity of hearing loss. Other sorts of ways to think about classifications of people are going to be based on very special needs. It may be based on what the educators say. It might be based on what the persons feel is their best way to communicate. So maybe people who use the visual channel would consider themselves as sort of deaf individuals, maybe more so than hard of hearing individuals. It could also determine the setting in which the services are provided. If you're in a business, well, maybe you call them clients or customers. If you're in a speech and language or hearing clinic, then you call them clients. So if you're in a hospital setting, we call them patients. So the names will vary depending on the location to some extent. And additionally, much like their preference in terms of what's their primary channel for communication, is that some people will culturally identify possibly with one group or another. So to get down to it again, to expand this basic idea is that we could call them students if they're in the schools, or patients or consumers. We could call them deaf or hard of hearing. Now, this major distinction is a distinction that's utilized by the Hearing Loss Association of America. So HLAA and that link that I gave you, hearingloss.org, these are the two that they use. They use a small d deaf and hard of hearing. And the presumption here is that people who are deaf would be people for whom their ability to use the auditory channel is going to be very significantly challenged to the point where it has to be supplemented by visual channel information. Hard of hearing would sort of describe individuals who need some assistance to hear beyond what normal had been for them before. There's another distinction, which we're going to say small d or capital D deaf. At Cal State Northridge, you have the distinction there of being with students who culturally identify with the deaf. So capital D deaf implies that the person is a culturally deaf. That this doesn't necessarily bear on how much hearing they have, as small d deaf and hard of hearing would be. This just simply means they identify with the American deaf culture and use American Sign Language. We could call them certainly a person with. I mean, we should be using person with language, so person with hearing impairment. Impairment is the words that are used for World Health Organization, so I guess they're supposed to be neutral. Impairment always had kind of a negative connotation to me. But in addition, we also use the expression hearing loss. Hearing loss to me sort of implies that an adult onset, that they had it and lost it. I never really liked the expression hearing loss. It's like I lost my keys. I don't know where they are. I lost my hearing. Where's your hearing? I don't know where it is. So I'm not so sure about, but it's a very, very commonly used word. In fact, HLAA is for Hearing Loss Association of America. We could say that people have a hearing difference, and this would suggest the notion that they might have a genetic aspect to their hearing loss, but not used very popularly. So to give it sort of a neutral spin, I would rather say that the people that I'm interested in are the people who have hearing problems and needs. And again, one of the factors here that's going to be one of the key overarching features is the idea that we're working with individuals, and so we should always keep sight on the individual, because that's really what the most important aspect is. Last slide before we transition is just to make the point that in addition to the person who actually has the impairment, that this is something that affects not only their quality of life, but affects their communicative partners, their families, their teachers, and everyone else. And so the improvement of communication function is something that benefits not only the person with hearing loss, but their communicative partner as well. So we'll expand on this idea as we go through, that in many cases, the quality of life improvement that occurs for an individual with a hearing impairment really is something that benefits to much larger extent their family members. On that note, we'll adjourn to slide set number 3.